Welcome to the Health and Mind program, a new program on Forum TV USA. Forum TV USA is a TV initiative from the North America focused on the mental health. Forum stands for the mental health, migration, multilanguage, and culture and mindfulness. We are practicing mindfulness beyond the borders. My name is Moshaffayata Joty. Currently, I'm living in the United States. I'm an ECFMG certified physician, and I'm currently working at Mayo Clinic in cancer immunology. Currently, we are living in the world of pandemic due to the COVID-19. Although it has been a long time since the pandemic started, we all are facing new challenges every day. As we know already, most of the people infected with the COVID-19 virus will experience mild to moderate distress, illness, and recover without any special treatment. But older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious symptoms and are more likely to be hospitalized. In course of time, we all know more or less about the COVID-19 and trying to take precautions and follow the social distancing guidelines. While the vaccination efforts are ongoing, the virus is also adapting more abilities, and current one is the Delta variant. The Delta variant originated from the India, which is most contagious and is raging through all over the globe. So today we will discuss the latest updates on the COVID-19 variant, the Delta variant, and its impact on our mental health with our special guest. She is a board-certified physician in internal medicine and practicing in the United States over 18 years, 11 years as a hospitalist, 2 years in the ER, and rest as a primary care physician, and last 2 years on the telemedicine. Welcoming Dr. Shamima Satrar, Runa, to our channel.
Thank you, Dr. Jarin Joty, and thank you for doing this wonderful program. It is an honor to be here.
Thank you. Hello, Dr. Sattar. How are you?
I'm doing great. I am so happy to be here with you and everybody else. And thank you again to the staff. I think you had a question about Delta variant and what's the concern. Well, two things. One, it is 40 to 60% more transmissible. So that makes it very, very dangerous. Another thing is that it is also multiplying very fast. Part of it is a couple of mutation. One of the mutation helps us to invade our lung tissue, thus get us more infected. And the second one is a mutation in cleavage. What it does, it allows it to multiply very fast. So what is happening in a UK study, it shows that the multiplication time right now is as low as 11 days. That means the viral load is doubling every 11 days, and that explains why it's spreading so fast. But the good part is all the people who are getting infected by the Delta variant, 99.5% are not vaccinated, which proves that vaccine works. So far, the Pfizer, Moderna, as well as the Johnson & Johnson are all working. So I will encourage everybody to get the vaccine. If you don't get the vaccine, you're just inviting COVID-19. Remember, if it transmits to anybody, in even one body, what is it doing? You are allowing it to mutate. And when it mutates, it becomes more powerful each time. And all the hard work we did with the vaccines, all these vaccines that currently work, after a few mutations, it may not work. So let's not lose this opportunity. Please get vaccinated. That's the only one thing you can do. And of course, mask up, isolate, and keep social distancing.
Absolutely, Dr. Sattar. We know that 50% of US adults are already being fully vaccinated. But last week, the number of cases has been doubled, and 47 states have higher number of cases. We know that the Delta variant is 2 times more transmissible than the original variant. Dr. Sattar, can you please share your views and why the Delta variant is different from the previous one?
Well, one of the things is symptomatology, right? We have a UK study that is Zoe study. What it does, it recognizes the symptoms. So it is a registration of every symptom that happens after COVID-19 occurs. In this Zoe study, it showed that people were reporting sore throat, runny nose, which is very common in allergy and common cold, right? It's maybe mild fever. So people who are getting these mild symptoms of cold and common flu, they are thinking they are not getting the COVID-19. They just have a common flu, and they're walking around, going to a social parties and all that gatherings, and they're transmitting to other people. This is very concerning because they are not keeping the precaution because they don't know they have COVID-19. And that was part of the reason it is being transmitted. And remember, another concern is this Delta variant antibodies that we give in the hospitals, the IVIG, it may not work. So that is very concerning because that's our lifeline, right? The first lifeline treatment we give in the hospital. So we need to vaccinate. There's no other way to it.
Exactly. Before it was vaccinated people and the unvaccinated people. But now, if we don't get the vaccine, because this virus is so transmissible, it will be vaccinated people and the infected people. So, can you please tell the viewers if the current vaccines can protect us from the Delta variant, and do we need a booster dose?
Current vaccine can protect us. So far, all the studies shows that it can protect us from the current Delta variant, even the Delta plus. So it is important, though, that we do not allow this vaccine, this virus to keep on mutating, like I said earlier. The booster dose has already been approved in Israel, France, and UK. CDC 2 days ago has actually said that they are also considering the booster dose in immunosuppressant people.
Oh, all right. That sounds great. And we all should play our part in preventing the spread of the virus and secure ourselves from severely affected by the new variant. And the recent data also showed that 99% of the people who got infected with the COVID-19 are unvaccinated. So we should absolutely get vaccinated. Now, there is another concern about the vaccines. Is there any effects of COVID-19 infections on the reproductive age of the man and the woman? Does it affect the fertility?
Well, actually, there's a couple of studies that we can talk about here. The first study was done in China. About 373 people were included. The inclusion criteria was they will have to have a uterus and ovary, a normal ovary in reserve. That means they will have intact eggs for fertility, and they will be having normal menstrual cycle. In that study, it was shown about first to two cycles, there was a change in the menstrual cycle period, the length as well as volume. The length was usually a little bit longer, the volume was a little bit less. But this was temporary. And after two cycles, this was reverted back to normal. So this is nothing to be concerning about for even for the vaccine, because when we did the study and went back and looked at people who we are reporting here in our symptom recognition system, it showed that it was 0.003 or 0.002%. So it's nothing statistically significant. So absolutely, it did not affect any fertility in women. Yet in men, there was a different report. Unfortunately, there was a very, very small study. Only 43 people of men was included, and there was three median age group in this group. So there was a 35 age median group, there was a 42, and the last one was about 52. In this age group, when the study was done in prospective study, that means if you go in one time and then go forward and see what happened after they had the COVID-19 infection, it showed that the younger group who was at home did not need hospitalization, got better with conservative therapy. We saw that the sperm motility was down, so it was decreased. In the other two age group, the median of 44 and 52, it was seen that all four criteria, sperm motility, volume, count, and the quality was all decreased. In the age of 52, there was even seen some cases for azoospermia. That means they had no sperm at all. From the studies, it was made that at least 3 to 6 months they will have infertility. But after that, what will happen? We need more study. These are more observational studies going on. So as soon as we have more report, we will let you know.
Yes. And if a woman misses 2 cycles of menstruations, they should definitely go to their primary care physician. But viewers, as you just heard, the vaccines are safe for the reproductive age group for the females, and it doesn't affect in the pregnancy. So let's talk about the vaccine for the kids. The Delta variant is also affecting the kids, in some cases more severely. In the United States, everyone aged 12 and up are currently eligible to get the COVID-19 vaccinations. The CDC and the American Academy of Pediatrics recommend that everyone in this group get vaccinated against the COVID-19 as soon as possible. When do you believe the vaccinations for the children below age 12 years will be approved by the CDC?
Well, I'm afraid I'll have to give you bad news. It's going to be delayed until midwinter. Initially, we were thinking it will come out by September. Remember, 5 to 11, this is an entirely different age group. So CDC and FDA always thinks 12 and 17 are little adults. And the age between 5 to 11 is a totally different age group. So they're doing a different dosage of 10 microgram that is studied. That is what the studies are going on right now. So they have to go through all this data, and it's a totally different evaluation. That's why it's taking a little bit longer. We are hoping by midwinter, we should have some more information.
Thank you. So when the vaccination is approved, it is wise to get your children vaccinated and secure them from severely affected from the Delta variant. I have one last thing to talk about. As many of people are struggling with both physically and mentally while adapting to the new normal. Dr. Satrar, can you please share your views, what people can do to cope up with this deteriorating mental health during this condition?
This is a big concern. You may, in telemedicine, I actually admit more than 20 hospitals with psychiatric patients. I do medical clearance as well as psychiatric admissions. And unfortunately, our psychiatric patients number has doubled. This is very, very concerning. Couple of studies. One study done in China showed that there has been an increase in severe anxiety. It's about 29%. In case of depression, it was an increase by 17%. In USA, there was a separate study that was done that showed serious mental health impact for about 36%. And guess what? Alcohol consumption went up by 32%. And alcohol relapse, abuse, that people had stopped drinking, they went back to alcohol. And they had a relapse, and that was about 20%. This is very bad news. So what can we do about this? Yes, COVID-19, think about this. People are losing their job, their home, they cannot pay their rent. They're losing several family members. Sometimes if they're unvaccinated family, several members are affected at the same time, and some of them may be hospitalized. I had a patient who called me, she could barely talk. And I said, did you get the vaccine? She said, no, I'm going to get it now. My husband is even worse. I don't know if he will survive. So I was like, why didn't you get the vaccine? So her answer was, I'm going to get it right now, as soon as I'm over this. And I was like, it's too late. You already got the COVID-19. So please, viewers, don't wait until you get sick. You can see that younger people are getting infected, and they are more prone right now to this infection. So you really, really need to get this vaccine. And for mental health, what can you do? Please keep contact with your family. Talk to them, have video chats, talk on the phone. Please do a very good routine. A scheduled routine helps with your mental health. Do exercise. If you do 35 plus minutes, even 150 minutes per week and 35 plus minutes a day, even if you do it in small increments like 10 minutes, 15 minutes, 20 minutes, whatever you can between your lunchtime, your dinner time, go and take a break. Go walk. Start with a walk and gradually increase your exercise intent about 10% every week. These all helps. Studies showed it affects and causes change in your amygdala and hippocampus. These monitor your depression and anxiety. So if you do that, it will really, really help. And it takes only 6 weeks. Can you believe it? So why wouldn't you exercise? So exercise, eat healthy, sleep healthy, go to bed on the same time every day, and wake up at the same time every day. Guess what? One of my attendants used to tell me with a smile, bed is for sleep and sex only. So try to remember that, okay? Also, very important. Remember what 4M does? It encourages mindful thinking. So please meditate, please pray. Meditation, mindful thinking is very important for mental health. So please do that. It is very, very important for all of us, whether you're healthy or unhealthy, whether you have mental health illness or not. And please don't think of it as a stigma. It is not a stigma, all right? You have diabetes, it's a disease of your pancreas, right? You have heart disease, it's a disease of your heart. Same thing, depression is a disease of your brain. There's nothing to be stigmatized about. Please talk to your family. Write a journal if you cannot talk to your family members and your friends. And if that doesn't work, you feel like you're drowning, you have no help around you, please talk to a professional. And you can also call the Suicide Prevention Lifeline. And I want to give you the number 1-800-273-8255. You can call that line. It's a Suicide Prevention Lifeline. And if nothing else, you can find me on Doctor to Help. On Doctor to Help, I have 4 videos. One for depression, what are the types of depression, how to treat it without any medication, how to exercise to help with depression, all right, and diet and exercise that also helps with preventing depression. Feel free to look at it, and you can look me up. And absolutely get the vaccine. That's the best thing you can do for you and your family, all right? So go get the vaccine. And again, thank you for such a wonderful conversation, Dr. Joty and everybody from 4M.
Thank you, Dr. Sattar. I really appreciate that you came here today. That's all about today's discussion. At a time like this, I hope you enjoyed our sessions and the information we provided have been helpful for you all. I urge you to take care of yourself and your families and the people around you. Stay safe and get vaccinated as soon as you can. Thank you.
Thank you.